We're going to go ahead and get started. Welcome, everyone. I wanted to welcome everyone to the webinar tonight. For those of you who don't know me, my name's Dr. Lauren Levine. I am your host. I'm your moderator. I'm always thrilled with the turnout that we get for these webinars. Hundreds of people signed up. As always, I hope that everyone is staying healthy and safe out there. I commend you for being here this evening and continuing your dental education. As we all know, that the need for education really never ends, and I'm glad that everyone's here tonight. I'm only going to speak for a few more minutes. I want to make sure that Dr. McClintock can speak for as long as she needs. We also want to leave time at the end, as we always do, for questions. On the bottom of your screen, you have a little Q&A icon. You can click that and just type in your questions. Obviously, when we have hundreds of people on the webinar, we can't do verbal questions. But if you type them in, we'll do our best to get to as many of those as possible. In the next few days, look for a few things. You will get an email link to download the recording. So don't worry if you got to take a phone call or the kids are screaming or whatever. You're not going to miss anything. During the webinar, Dr. McClintock is going to show some of the products and systems that she uses, which are exclusive to TDSC and Shine. I want to thank them for their sponsorship of these webinars. They're the ones that bring in these amazing speakers. They're the ones that work with the speakers to develop the content. They're also the ones that handle the CE. And I know that not everyone signed up for the CE. For those of you that did, what will happen is that in the next day or so, you will get a link to your email. You click the link, you have to fill out a very short survey, and then the CE form will be sent you. That can oftentimes take a couple of days after you've filled out the survey, but it will go out to you. So stay tuned for that. Keep an eye on your inbox if you want the CE form. So I'm pleased to welcome and introduce Dr. Devin McClintock. She's a graduate of State University of New York at Buffalo School of Dental Medicine, where she graduated in 2016. She graduated with honors and a minor concentration in aesthetics. After completing 2 years of her GPR and a year as an associate in a private practice, she was one of a few residents selected to complete a 2-year residency with the American Academy of Cosmetic Dentistry. Currently, she is an owner at a private practice in Williamsburg, Virginia. So, Dr. McClintock, we are thrilled to have you here and looking forward to tonight's presentation.
Awesome. Thank you so much, Dr. Lean. I really appreciate the introduction. Hi, I'm Dr. Devin McClintock. I just wanted to also take a chance just to thank you for Hands Online Live and for, again, the Dental Supply Company by Shine. And really, most importantly, to Clinician's Choice. Clinician's Choice has been a part of my life and my practice for several years now, and I could not be more grateful to a dental supply company for creating such wonderful products, most of which you will see today. Just to go off of what Dr. Lean said, if you have no idea who I am, hi, I'm Devin. Like Dr. Levine mentioned, I have done quite a bit of education since I graduated from dental school, hard to believe, 8 years ago. But I graduated in 2016. I did 2 years of practice as GPR, decided I didn't have enough fun with 1 year as an associate after all that I went back for 2 more years. And then I worked again for about 1.5 years. And then last year, I'm really proud to say that I officially crossed associate off my bucket list, and now I'm a practice owner. In 2023, big things happened in months that began with the letter J in my life. The first of which, in January, I bought my practice, and Precision Dentistry of Williamsburg was born. And then not too long after, in July, I actually had my daughter, Leslie. So these are the 2 biggest things that happened to me in 2023. Needless to say, 2023 was a really big year. 2024 has been a little bit calmer, thankfully, but it has been an incredible ride over the last 8+ years being a part of this profession. And I'm really excited to share a little bit of my journey and my technique processes with you today. Before I start, I like to always take time to really thank the mentors who have helped me become me. In dentistry, it can be really lonely, especially if you're at a solo practice like myself, or even just a smaller practice where you don't have as much communication or integration and collaboration with, our peers. And I will say I would not be the person either professionally or personally without these three people. And if you don't know who they are, here are their names. Please find them on Instagram, bug them. There are three of the most brilliant but kind and incredible educators and clinicians. And I am so grateful to have them as a part of my life. And I just always like to take the time to thank mentors, because we are what comes before us, and it kind of comes full circle. I'm very fortunate that, they've taken the opportunity to mentor me, and now I can mentor other clinicians, and especially dental students. And I actually have a dental student working with me right now for an externship who should be on this webinar. So Kelsey, this is a test to see if you made it here tonight. But I'm so grateful for the mentorship I've received and that I can give back as well. And then my other favorite thing to start with is one of my favorite quotes that I try to embody every day and remind myself of, but becoming is better than being. I mean, it's all about having a good growth mindset. Dentistry is constantly evolving, something I was literally talking about with a patient and my dental student today. We're constantly developing new techniques, new materials, new systems. Dentistry changes every day, and it can get very exciting, but it can also get overwhelming. And it's just really important to remember it's not about the destination. It's about the journey getting there. So this is one of my favorite quotes by Carol Dweck. That's from her book, Mindset. Chris and I talk about this every time because he even asked if it was going to be here, and I assured him it would. But this is a great, great book. If you're looking for a good read or listen on your drive to or from work, I can't recommend it enough. So here we go. So achieving consistent class 2 success. I mean, the biggest question is very simple. How do we maintain consistent, reliable restorations that are going to last our patients a long time? One of the things I like to remind my patients every time they come to my chair is nothing we do lasts forever. No material yet is as good as our natural tooth structure. But when restorative intervention is required, we need to be doing everything we can on our side to try and ensure the longevity and consistency of that restoration, because nobody likes to get a phone call from a patient saying my filling's broken or it came out or anything. So we can't really discuss the how we're going to achieve these restorations until we really talk about the what are the biggest issues that clinicians face with class 2 composites. And I think it really boils down to two main things. And one, they're technique sensitive. I remember being in dental school on my pediatric rotation, talking to one of the pediatric residents who said one of the pediatric dentists that he shadowed actually refers all class 2s on permanent teeth, whether it's premolars or molars, to a general dentist because they don't have the time. They don't want to do it. They don't want to take the time to do that technique. It's really technique sensitive, but if we can learn a couple of tricks and systems to really make sure that we get a good seal of our matrix, we're going to have a lot more successful restorations down the line. And the second big thing is materials matter. I remember a really horrifying moment. I was helping cover a practice when the doctor was out on maternity leave. I had just done this beautiful class 2 restoration. I had finished on time. Actually, I think I was done 20 minutes early. It looked beautiful. The anatomy was beautiful. I cured it, went to go remove the matrix. I could not get the matrix out. I literally could not get the matrix out. It fused to the composite. I tried hemostat. It just tore apart. It got to the point where I had spent a solid 5 straight minutes, which doesn't sound like a long time, but trust me, if you're trying to get a matrix out, you're trying to floss it, trying to seri saw it, trying to do everything. Ultimately, I had to actually cut out the brand new restoration that I had just placed, so that way I could actually get the matrix out. So choosing good quality materials makes a difference. But ultimately it's not the arrow, it's the archer. So understanding not just using good materials and techniques, but understanding the how and the why we do things a certain way. So I don't know about anybody else, but personally, I learn the best when talking through cases. So I'm going to go through a live case that was one of my patients. And then we're going to get into a little hands-on where I'm going to go through step by step exactly what you see here in the case. So this was a restoration on actually an assistant at the office that I worked at when I was doing my AACD residency up in New York. And she had a class 2 lesion that we needed to go ahead and restore for her. So first things first, we isolate. The rubber dam is your friend. I'm telling you, don't get the PTSD from dental school. You don't learn how to use it properly in dental school. Take a course. I'm telling you, it's worth it. It makes your life so much easier. Not only are we going to get the best out of the materials because we're keeping everything dry and we're not worried about contamination, but you actually have better visualization, better retraction, and everything will go a lot smoother. But similar to how we learn different techniques in dental school, it takes a while to get good at it. But unfortunately, this is not a webinar about rubber dam isolation. I could talk about that for an hour or two if you wanted to. Just call me, email me, and we'll happily talk about it. So I isolated the tooth, removed the caries. What you're seeing here with the pink is caries indicating dye. I personally always use this just to make sure I am getting a good read on not just where the caries are, but that I've gotten complete removal, or I'm at a removal endpoint that I feel comfortable with. And it's also telling me what the strength of the bond of my adhesive will be to the different various tooth structures. Infected dentin bonds differently than affected dentin, which bonds differently than totally clean enamel. But what I'm always looking for is that clean peripheral rim. So that way I have a good bond all the way around. So you see there's a tiny, tiny little bit of pink, but it's all the way actually, I've got clean margins all around. I'm pretty happy with this endpoint. So the next thing I'm gonna do is I'm gonna place my wedge. One of the nice things about the system that you're gonna see tonight is that it has these little tabs that are great. But the thing that I like most about these bands in particular is how well adapted they are. I mean, this is without a wedge and without a ring, and you can see just how nicely the anatomic contour of these matrices is adapting to the tooth structure and how my box is literally already sealed apically. Of course, I'm still going to use a wedge. I'm still going to use my ring, but once we're already starting, and again, this is what I'm talking about with using a higher quality product, you're better able to streamline your process. I'm not trying to contour or burnish a band. It's already contoured anatomically. It already is designed to have that marginal ridge anatomy, and it's going to make my finishing and polishing so much easier. So in this case, I went ahead and I put my wedge in here. It was a purple wedge. I try to use the largest wedge I can fit without distorting the matrix and getting a good seal. And in her case, she had a very tight contact between these back teeth. So we used that narrow purple wedge. And then I went ahead and put my ring. These are the dual force rings. The really nice thing about them, one, is that they're labeled. So you know which one's molar, which one's premolar. However, really you got to use the band or the band that's going to be, or the ring that's going to be the best fit in the situation. She actually had smaller teeth. So I found that the premolar band was working a little bit better for me. But what you'll notice is it's really tight on the buccal. However, the lingual, it's still pushed up against the tooth, but it's not as sealed as it could be. So one of my favorite little tips and tricks, and I'll show you that tonight as well, is I like to use a little Teflon tape. So this is just plumber's tape straight from Home Depot. And all I did is I cut a little strip of it, rolled it up, and kind of just packed it into that area. Not so much to really force it against the tooth, but just to give it a little bit, the band a little bit more resistance. So that way I'm not getting any pushback from the band as I'm placing the composite material in the box and keeping that matrix nice and flush. Just a way to, again, adapt the ring to fit a little bit better because everyone's anatomy is slightly different. And then we go through our bonding protocol. So in this case, I always clean the tooth first. So I have the Prep Start. I don't have this exact one. This is the photo I could find. I have just the air abrasion unit, which is the 27 micron aluminum oxide at 40 PSI. And this runs about $2,800 to $3,000. When I was an associate, I actually went ahead and bought one for myself. I tried to pitch my office to get it. They wouldn't go for it. We made a deal. They ordered it from Henry Schein and deducted the fee from my paycheck. So that way I could still get the equipment that I knew would help enhance my bonding. while they didn't have to pay for it. So everybody won. And my only agreement was, if we're doing it that way, that's my piece of equipment. And if I leave, it comes with me. And I will tell you, I use this every day in my practice. When I ultimately purchased my practice and moved practices, I did bring it with me. And I actually bought a second one. So now I have one in each doctor operatory, so I don't have to worry about moving back and forth, which makes my life easier. And my assistant loves me a lot more for it. I just mainly want to talk about that because if you're an associate in a practice and your practice is not investing in the equipment that you want or that you know will make your restorative restorations better, don't be afraid to ask. Don't be afraid to negotiate. Try to work with them to figure out a solution that's beneficial for everyone. Because I'll tell you, you'd rather take the initial hit and be able to have the equipment that's going to help you have those better, sustainable long-term restorations than do subpar work that may come out more frequently. You're going to have more patients in the chair coming back and forth for repairs or replacements. It's worth making the investment. Invest in yourself. Then I personally do the selective etch technique. So I try, especially, I know it's hard in class twos, but as best as possible, I try to keep everything localized to the enamel. I like to place the etch for about 12 seconds. Really, anything between 10 to 15 seconds is ideal for enamel. And so I always go with 12 because that gives me a little bit of buffer each way. And then I rinse. And in this case, we're going to use the Clinician Choice MPA Max adhesive. So what I always tell providers is, whatever adhesive system you're using, talk to the rep from that company. They want you to succeed. They want you to have good outcomes with their product because they want you to keep using their product. So find out what the best system is or protocol is for the products that you're using. The way I bond, I do 2 20-second scrubs without air thinning between, and then I air thin at the end. And the way I personally air thin is I have my assistant take the high speed suction and come right over the prep. So that way we're really pulling that solvent and evaporating the solvent rather than blowing the air down. Because again, remember, we have those collagen matrices and we don't want those fibers to kind of fall over. We were trying to keep that matrix intact. So I usually do this for about 10 seconds. Sometimes I'll come from really far away with the air syringe, and ideally just air, not air water, and really lightly come in just to get that last little bit of solvent evaporated. Once I'm done, I light cure for 20 seconds, and then we're ready to restore. So in this case, I used A3 Universal Evan-S composite. I really like the Universal composite. I think it handles really nicely. I personally like a little bit stiffer composite, and I like using modeling resin to help just wet the instrument. So that way I'm not pulling the resin away from the tooth. I find that it packs really well. So I can really design the anatomy as I'm building the restoration, which you'll see in a little bit. But you see, I build it up for full contour. I don't do it all at once. I'm not a huge fan of bulk fills yet, only because I find that they end up slumping and they come very flat. And the ideal restoration, in my opinion, is to mimic the natural tooth structure. The brain wants those hills and valleys. The teeth want those hills and valleys. And my biggest problem with the bulk fill is they kind of self-level. So it kind of creates this like flat saucer. So if I'm doing any kind of bulk fill, I might do 85% bulk fill and then do the last 15% as packable, just so I can build up that anatomy. But I also, majority of the time, and I rarely use bulk fill now. There's a lot of cool things and materials that's coming out, and maybe one day we'll have a little bit better packable bulk fill, but I'm not there yet. So I like to layer the composite, and I do layer in my 2 millimeter increments. And again, we'll show you as we do the live portion at the end. So I build it all up. I take the matrix out. And then this is something that I like to do just as an added security measure, if you will. Since I have that matrix there, I like to then have my assistant, when I pull the matrix out, come from the buccal and come from the lingual, just so we're making sure we get a really good depth of cure of the material. As you see, I have a really nice contour, and I really don't have that much adjustments to do. What I'm really going to do while the rubber dam's in place, I'm just going to kind of smooth out that anatomy. I really try to follow the contour of her existing tooth structure as closely as possible. So I'm just using the ASAP polishers here. just to polish everything up before I take everything off for the rubber dam and check the bite. But what you see here is just, we have a beautiful anatomy. And remember, in the posterior, we're not looking for one point of contact. We're looking for almost a contact area, almost an oval between the tooth. And the reality is it perfect? Absolutely not. I am a firm believer that I am not perfect and I don't do perfect, but there's always room for improvement. You can see I could have polished the mesial aspect of the posterior tooth, of the adjacent tooth, a little bit more to get a little bit more ideal. And, the marginal ridge could be a little bit more defined. The anatomy could be a little bit more defined, but all in all, this is a really nicely contoured restoration. And I barely had to do any adjustments. I think I didn't have to do any adjustments interproximally where that matrix met. Because the reality is, if you take the time to do the technique and not rush through the preparation stage and really take the time to prepare for that restoration, make sure that matrix is steady, make sure that everything is sealed, make sure that band is in place. And if you need to modify the band, you modify the ring, you modify the band, you modify the matrix, whatever you need to do to make sure that when you pack that material in there, it's not going to go anywhere. It's going to make a huge difference down the road, and you're setting your patients up for better long-term success. So again, if you can do things the right way the first time, then you'll do it hopefully once and have a better long-term success. So before we get into the hands-on portion, I'm just going to kind of briefly go through the armamentarium of what I'll be using today. So first and foremost, this is the dual force system sectional matrix kit. So this is a staple in my practice. This is pretty much all I use, and we're going to go through it. But basically it comes with 2 rings. Again, they're color coded. I have the premolar ring. I'm notorious for using premolar ring on molars. I am a person who has really tiny teeth, so my molars are the size of some other people's premolars. So really, while it says molar premolar, they're not. Nothing is written in stone. You have to adapt based off of what each individual patient and restoration's needs require. We've got the wedges. These are some of my favorite wedges because that wave and that ring actually helps, that hole at the end helps those wedges keep their form and really, again, adapt to that ideal interproximal contour, which is what we're looking for, to make sure that that floss is really nice and clean every time we go up and down. The matrix, as you can see, we've got that nice contour. And again, it curves up and in, and that little tab tells us, exactly where our marginal ridge is going to end. So that way we know where we need to be and make sure our matrix is placed exactly at the point. And then we have our forceps, of course. So let's get hands-on. So before I go ahead with the hands-on, I'm just going to kind of go step by step of the different procedures you're going to see, and then we'll get rocking and rolling. So let's go step by step. This is our class 2 prep. I'm going to apologize in advance. I had to just drill out my old class 2 prep. So if it looks a little rough, I'm sorry. I wasn't being extra thorough. But my first tip when doing a class 2, when you're prepping, is don't be afraid to use these wheels, these discs. These discs are some of my favorites. And one of the biggest issues I find that people have with placing matrix is they can't get the matrix to seat without bending the matrix or, warping it, or it's just too tight. And what I always recommend is if it's too tight, you can do a couple things. You can take one of these discs, which is what I'll show you today, and just kind of go on the buccal and the lingual just to get that contact a little bit more open so you can seat the band. And the nice thing about doing it that way is that then you're also beveling the enamel along the correct orientation. So that way, again, you get a really good bond of the adhesive to the tooth structure. If it's too tight or you can't get a good access with a disc, you can always use the interproximal strips. I've even used the IPR discs, just something to just, again, open it just slightly to get space for that matrix to go in. Personally, I like to stick with the coarser discs. So the way the system works is the darker the color, the more coarse the disc. So the purples are going to be more coarse than the pinks. And really for this type of thing, I only really need to use these dark purple and the lighter purple discs. So once you open it up and you select your matrix, for this case, I'm going to use the middle matrix. And I also have my wedge. You're going to place that matrix. And again, the matrices are really great. I really like the small matrix, the shorter one, for when I'm doing lower premolars or even upper premolars. And the thing I like most about it is it's so curved, it maintains its curve. So you can almost, like you saw with the case, be able to place the matrix and no ring, and it basically hugs the tooth, which obviously we're not going to do. But when we're placing the matrix, it really helps it stay put, because nothing is worse than when you place the matrix, go to grab your wedge, go to put the wedge in, and your matrix is like in Timbuktu. You have no idea where it went because it just kind of flew right out because it's not very stiff or contoured. And it's stiff, but it's not overly stiff. So again, I'm going to use the green wedge here. The green wedge is a pretty large wedge. This is not what I usually use in real practice, but the way that the embrasures on these Typodonts are, it's what worked best for that situation. And then here is my dual force ring. Again, I'm using that premolar. To be fair, the adjacent tooth is a premolar, but again, not above taking a little bit of Teflon tape and adding a little bit to the interproximal to seal it a little bit better. And then what you're seeing here is I'm just taking my instrument here. This is the REJ 10. I can never remember which number it is. But I'm not burnishing. And I think that's a really important thing to note is I'm not pushing against the matrix, but I'm to try and mold it against the tooth. Like I said, that band comes pre-contoured. What I'm doing is I'm actually just testing the stability of the matrix. If I can push on the matrix and it pulls away from the tooth, that's telling me I need to adjust either my ring, my Teflon tape, or something, because I'm not sealed up against the tooth. And that's going to cause more problems in when I'm refining my restoration, when I'm trimming it, when I'm polishing it, because now I'm going to have flash coming out the side. And I just want as stable as a matrix as possible when I'm doing my restorations. So normally I would do my air abrasion selective etch. This is a plastic tooth, so we're not going to be doing either of those. So here I am putting my adhesive. Again, I do 2 20-second layers. And then I'm going to go ahead and restore. If you don't have this composite gun, I'm just going to apologize already because you're going to want it. And unfortunately, I don't have it with me. My husband is in the other room right now. He's going to laugh when he hears this, but it's my second favorite thing that comes out of Denmark because my husband was born in Denmark. But this is the Rolls Royce of composite guns. And I have 4 of these in my practice for an operatory where I have 2 operatories that I work out of. And I just have to give a big shout out to my friend because I forgot to pack that when I was coming home today, which was heartbreaking. I just need to take one and leave it at home. But she came to my rescue and brought me one from her practice that is an old school one, still works great, but this one's better. If you've ever had the opportunity, or if you get the opportunity to play with it, highly recommend. You won't want to use another composite gun again. So if I fumble a little bit with this composite gun, it's because I'm used to the Rolls Royce composite gun. So you're going to see, I'm going to put the composite in. I like to build the proximal box and really close that marginal ridge first and foremost. So I can basically take my class 2 to a class 1, because once we get that box filled, then essentially we've just created a class 1 restoration. So by taking the time to essentially do the hardest part up front, it makes the rest of the procedure go by that much smoother. And then I'm also making sure that I'm getting a good seal interproximally and axially in that box, which is where we tend to see the most recurrent caries. So again, getting that sealed first and foremost is critical. Additionally, as I mentioned before, I use the modeling resin or the resin blend. I don't like to use adhesive because the adhesive has the HEMA, so it can cause discoloration and interfere with your bond. I don't like to risk it. So I use the modeling resin. That way the composite doesn't get stuck on the instruments or the materials as I'm packing and layering in the composite. This is my desert island instrument. This is the Composite Ninja. This is my go-to. I can pretty much do anything with this, but one of my favorite things to do with class 2s is it's a very thin but stiff IPC instrument. And it's a really good way to just kind of fine tune that marginal ridge before I cure that box. And it really just defines it really nicely. You can use like a really sharp explorer. I do that as well. But I really like the double bend in this instrument because it allows me to really get in that area and really contour the restoration really nicely. And then, as I mentioned, I went ahead and light cured. Do yourself a favor, get a really good broad spectrum light. That way you make sure your composite is always cured to the maximum capacity. This is the Velo. I also have the blue phase here. But those are probably the two best broad spectrum or broad wavelength lights on the market. Again, thank yourself later, invest in quality products. All right. And then once I have my class 2 essentially reestablished as a class 1, then it's about restoring a class 1. Again, like I mentioned, I'm really big on layering composites. So I like to, especially in a case like this, where we have a little bit of a deeper box, we know we're going to be doing multiple layers. So I like to kind of do that first initial layer and keep it, again, 2 millimeters, and just use my instrument, use the packer side, and just kind of pat it down again with that wetting instrument. So that way the composite isn't sticking to the instrument and then pulling up with the instrument, creating that air pocket or a little gap, a micro gap on the floor of the box. We're trying to avoid that. If we can avoid that gap at the floor of the box or the floor of the restoration, we're going to help reduce our sensitivity post-op. After I kind of do that initial pack down, I always like to go back with microbrush, easily one of my favorite tools, and basically just kind of really smooth that initial layer. And then I light cure it. So by doing that, I kind of pack it down and have like a nice level layer to build off of. And then I just pretty much go cusp by cusp. Again, being respectful. If I need to add another layer, I'll add another layer before I start building my cusp to maintain respect to that 2 millimeter thickness. And then I just kind of go cusp by cusp. Again, this is the Composite Ninja. I love this instrument so much. And I just use that double bend too, and that really flat, stiff IPC to follow the contour of the patient's existing molar. So that way I can build it as ideal anatomy as possible. Because again, I'm not looking to carve the anatomy after I place all the restoration or restorative material. I want to build the anatomy as I'm restoring the tooth. So you'll see, I just build it with the end in mind and I go cusp by cusp. So with a molar like this, especially a first molar with a wide isthmus, I really just take the time. I like to go diagonally. So that way I'm kind of building it across the tooth and building those grooves in as I go. And I'm just following the same pattern as I go, using that Composite Ninja, following up with the micro brush to again pull the composite up and over the margin with the tooth to make sure everything remains sealed. And we're just going layer by layer until we get to our final cusp, and we just keep going. And the nice thing too about this Composite Ninja is it's again very thin, and I can really define the grooves in the anatomy. Again, you can use like a very sharp explorer. Those work really, really well, but this was me once I finish adding the layers without doing any kind of carving other than really being intentional with the placement of my IPCL and how I was molding that composite as I was building it. Again, finishing with that micro brush, I'm just, again, pulling it over the enamel that's been etched and bonded, just to, again, make sure our restoration is nice and sealed and our tooth is sealed. We're going to come in with our curing light. And again, once I take the matrix band off, I'm going to go ahead and cure from the buccal. I'm going to cure from the lingual. And then this is it. So here you see, if I have a little bit of flash, sometimes I'll again take that disc. This is the coarse disc. I don't usually do the coarse disc unless I have like a significant enough piece, because I don't want to flatten that beautiful contour that we just established. I'm just trying to go from the restoration to the tooth just to kind of brush off any flash. Using a 12C blade or a curved, very thin scalpel is also a really good option here if it's a very minimal amount of flash. But you can use the coarse disc. I personally would prefer to use the lighter purple disc, because it's a little bit more flexible. So therefore you can kind of bend over the marginal ridge. It won't flatten it, but more curve and mold it. And then I just go ahead with my ASAP polishers. I'm going to start with the more coarse purple. And again, I'm trying to line the anatomy up with the contour of the cusp that I just built. The last thing you want to do is flatten this beautiful anatomy that you just built with the polishers. You don't want to just flatten everything out. You really want to maintain that. So you want to be really careful and intentional and use a light touch to really get that restoration just a little bit more polish and shine. And this is how it ended. This is literally how we finished this restoration. That was all the polishing I did. I did not go back with a burr or anything else, just those polishers and the discs a tiny bit. But otherwise, the anatomy was built there. The marginal ridge was there. We took the time to build the cusps one by one. So therefore, we had already built the groove without doing any additional work. And you can even see I did this at home and I didn't have any water syringe. You can even see a little bit of debris on the tooth from the polishers. And that was how it ended up. So let's go ahead and we're going to get started. I'm going to stop my share right now. And we're going to go ahead and I'm going to exit out of that. And we're going to share my camera here so that way you guys can follow along. And I apologize in advance that I don't have gloves. So please don't judge my bad manicure because I forgot to pack gloves too. I blame mom brain. I have an 11-month-old who's in the other room. So if you hear that cooing or anything like that, that's her. Okay, so we have our prep here. And again, I have a pretty decently wide prep, but if I wanted to go in and just do a little bit more because I was concerned I wasn't going to be able to get my band in place, one of the things, like I said, I would do is just kind of open up and again, just kind of flare that box out just enough, just so you can get really nice placement of the band. You just want just enough so that way you don't have to worry about any issues of placement of the band, because I've seen a lot of times and I've experienced a lot of times when you go to place the band and it just kind of crumples up on you. So next step is we are going to place a band, and I apologize in advance because this model's tooth is glued in. So I don't have a gingival pocket or a PDL or anything to push back. So I'm going to try and place this as best as I can. Well, you can see it's really nicely contoured to the tooth structure. You can see how it's really matching where that contact point needs to be. And again, if we just look at that, I'm gonna try to zoom in. Okay, can I zoom in anymore? I'm just gonna pick it up and try to do it. Let's see if I can focus. You can see that's with no wedge, no nothing, and it's pretty much sealed. Obviously, we're not gonna leave it like that, but that's how nice that contour of that band is. And what I'm doing here is I'm pulling this tab over the marginal ridge, but you can still see how it kind of curves up and around, following that anatomy of that tooth. So you know you're going to be able to floss between there really well. So what I'm going to do next is I'm going to go ahead and put my matrix or my wedge in. What I like to do is I like to keep a finger over this before I place it, because again, I'm just trying to, even though there's a nice tight contact there already and it's, well adapted, I don't want to add potential insult or risk of that matrix moving through the contact or having any issues. Now, another way to prevent that would be to put the band on first, which is a completely viable option. It's kind of dealer's choice. I like to make sure my matrix and my wedge are in place first versus trying to push the wedge through the band. But that's just me. That's my personal preference. So I'm going to do that. And again, we're just making sure, focus here, that everything is looking good and adapted. And now we've got a nice tight seal. And we can even see that we even have a pretty good seal right at the margins here. But you can see how it comes straight out. And again, my concern is if I push on this, will it push out? And the band pushes a little bit. Focus it. And I'm really trying to avoid that pull away from the rest, from the tooth. So I'm going to go ahead and place the band. Now the ring, nice thing about the ring is you can place it both directions. So for me, I'm going to be putting a rubber dam on this tooth. So I'm probably going to have a clamp on this back tooth. So having a ring facing posterior, it should honestly fit, but sometimes if I'm doing 2 restorations back to back, or if the rubber dam clamp ring is going to interfere with it, I'll place it facing forward. And the beauty about it is that you can do it either direction and still be perfectly successful. So I'm going to go ahead and place it as if there's no rubber dam. And again, sometimes what I will do is I'll just kind of hold my matrix and try to make sure I'm over where that wedge is, and then place my ring. And again, I'm looking here from all angles, making sure I'm coming out on either side. I'll usually give my wedge a little push to make sure everything is down. And you really want to make sure this is stable. So far, I'm looking pretty good. The nice thing about these rings too is that they will actually stack pretty nicely on one another. So honestly, right here, I think we're looking pretty good. I'm going to take my instrument here. And again, I'm just going to move my matrix, and I'm not really seeing any pullback. So you can see there's a little bit of movement when I push on the matrix, but you're not seeing it pull away on either side here. So I'm actually going to go without the Teflon tape because I think we've got good stability of this matrix right now. But let's say it was a little bit more open here, or our prep went a little bit wider, just to give it a little, the ring a little extra stability. We could take some Teflon tape and put it right in that between the ring and the matrix, just to, again, give it a little bit more stability. I like Teflon tape better than something like cotton, just because cotton pulls apart. It has the strings versus Teflon tape is a lot smoother, and you don't have to worry about it pulling apart in the little fibers. But again, that's personal preference. Okay, so moving forward, let's restore this tooth. All right, so I'm going to go ahead and get my bond adhesive ready. So normally during this time, I would be doing my air abrasion, and followed by my etch, and then going ahead with my bond. So again, I'm going to scrub 20 seconds, 2 intervals of 20 seconds. Because this is a plastic tooth, I actually don't even need to use adhesive because it'll bond because it's made of the same material. But just to kind of give you guys an idea of my protocol, flip it around so I'm not coming out the back of the throat. Unfortunately, I don't have air here, so just bear with me while I go ahead and just kind of let it evaporate on its own. And then what we're going to do is, again, I'm going to come in with my curing light. I personally cure for the 20 seconds. And I try to get as close as possible. The other things I like about these lights, and you can get these for any light, is the orange shield that's right on top of the tooth. But I try to get right on top of the tooth. And again, the nice thing about the matrix and the ring is it's going to keep you from really pushing down. Now, once I start building the tooth, I'm going to take a little bit more care and caution. So that way I'm not destroy my beautiful anatomy by pushing on the composite. We don't want to spend this time building this nice contour and then destroy it all. So as I mentioned, we're going to start with the interproximal box. I apologize if my composite's a little stiff. And this is quite a bit, way more than I need. But sometimes what I like to do is kind of push it down and into that area. So that way I'm making sure I'm getting a nice tight seal. And I'm going to get some of my resin blend. And what I usually do is I usually put some in on my glove that I keep. And by me, I mean my assistant, my wonderful assistant Sue does. But since I don't have my glove, I'm just putting it a little bit directly on the instrument. And again, I'm just kind of using it here to sculpt and really build that marginal ridge. And again, the beauty of this matrix is that it's pretty much doing most of the work for me. And I have to do very, very little adjustments. So I'm just gonna, again, take my micro brush now with the resin blend. material, the HEMA-free wetting agent. And just try to really pull that material over where it meets the tooth. Now I'm going to go through with my Composite Ninja and take off the excess. So we're just going to slice right off and really try to come in the top of the matrix. And I usually I try to start in the middle and kind of go buccal and then lingual. And you can see it's just a little bit angled, not too much, but just enough. I'm going to make my life easier. I'm going to put my loops on since I brought them all the way home. Managed to remember those. Again, just trying to really make this as nicely contoured as possible. And I always like to err a little bit on the side of putting more than too little, because it's a lot easier to dial it back, to contour it back than it is to add to the composite. But again, taking that time to be really intentional, make sure that box, that contour, this contour is going to set us up for the success. So we want to make sure this is as beautiful as possible following that band. So I'm pretty happy where we are. There's a little bit of extra flash on the facial, but again, it's in a spot where I can take that disc and I know I'm going to be okay. So I'm going to come in and again, try to angle so that my light gets as close as possible, and now without touching the composite itself, because we want that light to be as close as possible, because the light is going to dissipate exponentially. So the farther away it is, the less actual light is getting to the composite, and therefore your depth of cure is not going to be as significant. So again, because this is a little bit of a bigger, deeper restoration, I'm going to go ahead and do one layer on the floor here. And again, we're just going to pack that down, and we're not quite ready to restore our cusps. Now, if you're using a rubber dam, at this point, you could theoretically take off the clamp if it's in your way. You're not worried about losing your isolation, because remember, everything we use is hydrophobic, so it does not like saliva, it does not like bleeding. You could do that at this point. I usually, even if I take off the ring, I do not take off the matrix or the wedge, because even with the best rubber dam, like you saw in my patient case, there was still just a tiny bit of leakage that came through once you pull out the matrix, just because you have the shifting of the dam. So I usually will leave the matrix and the wedge in place, just as an added precaution. All right, so I just made a thin layer of composite just right at the base of that box, so that now when I add to my cusp and design my cusps, I'm doing so in layers that are less than 2 millimeters. So I'm not violating that depth of cure. I mean, with today's generation's lights, we have really good depth of cure, but I like to make sure I'm giving my restorations the best possible chance. And that means, you know, being respectful of the depth of cure. So now I'm just going to go through and contour. And again, I'm using my instrument as my guide to really make my anatomy. I'm really trying to be intentional. You can see here at respecting the cusp anatomy. So really trying to build where the cusp is, follow those grooves, follow the angulation. If you're rebuilding these cusps pretty significantly, then look at the adjacent teeth, see what the approximate angle and contour, you know, don't be afraid to move back here and kind of come here just to kind of get that approximate, you know, angulation. So that way you're really putting a nice cusp together. And then again, I always like to kind of pull with the micro brush. Obviously, it's a lot easier on a type-it-on. But this is one of my favorite things to do, is to practice on type-it-ons, because the more we practice, the better we get at everything we do. So if I can practice some class 2 composites on a type-it-on, I know that I'm going to be a lot faster when I get to the mouth. So again, I'm going to go ahead and cure. And again, designing with the end in mind. I'm not going back and trying to carve back my anatomy. I'm building my anatomy intentionally. It's funny because right now I've been having conversations with my team that our word of the month, or maybe the word of the summer, is intention or intentional. If we do things intentionally, we're going to get better results in the long term. And again, most of failure happens in the planning phase. If we plan appropriately, if we take the time to set our matrix up right, and we take the time to use the right materials, if we use the right instrument, we are able to expedite how we do things, the speed at which we do things, without compromising the quality of what we're doing. I need a little bit more modeling resin right here because my instrument's getting a little sticky. So don't be afraid to reapply. And again, we're just trying our best to mimic the natural anatomy that the patient already has. I'm pulling it up and over. This instrument is wonderful at also just removing excess. And again, defining those grooves. This is, when I say it's my desert island instrument, I really truly mean it. mean it. My assistant knows I need it in every room. We have multiple we have one in each of our restorative kits. And I could probably do any restorative restoration with it. And we have extras just in case something's going on. Filling up our cusps, almost there. And it's just kind of rinse, lather, repeat. Make sure we get our anatomy approximately where we want, packing down and pulling the composite up over our margin. Being intentional. And a lot of times I'll get some pushback from providers who say, it's taking too much time. You're never going to be profitable. But I will argue, what takes more time? Redoing a restoration over and over again, or taking the time to do it right the first time? 10 out of 10, taking the time to do it right the first time. Because you'll also find the better you build the anatomy, the easier your occlusal adjustment will be. Other times people think that it's going to take so much longer to adjust the tooth because you're building these giant cusps and everything. But really what you're doing is you're just adding back in the anatomy that they used to have, or that they should have had to begin with. And again, setting the tooth up for a much better restorative outcome and functional. And when you build these cusps kind of diagonally, one at a time, not only you're building the grooves, but you're building these marginal ridges. I always tell my patients the real torture during the appointment should not be the dentistry. The real torture is just my singing. So now you guys are subjected to my singing as well. All right, we have our last ridge. Oh, there's just a little bit of flash right there. And we're gonna go ahead. So now that we're done with our initial placement, You can always look around if you need to add, if you really want to get fancy, you can always add a little stain into the occlusal groove to try and mimic nature a little bit more. I don't ever really feel the need to do that. Patients don't really care for it. But what I'm going to do now is I'm going to remove my ring. Maybe. There we go. I got my matrix in there too. I'm going to pull out my wedge. What I like to do is, like I said, I'll bend this back a little bit and then I'll come from the buccal. And then I will come from the lingual just to, again, ensure the cure. And this is where I will usually use my hemostat, because what you'll find a lot of times, but unfortunately I don't have that with me, is this is a tight contact, which is exactly what we want for our restoration. So sometimes you have a hard time getting that band out. And that's a good problem to have, because that means that our contact is nice and beautiful. And if you can see there, I mean, you don't get much more beautiful contact than that. You can see how beautiful that contour is. You can see clearly it's nice and wide. The floss is going to hold a really tight contact. And I just have a little bit of flash here on the buccal, which I mentioned when I was restoring. So all I'm going to do is come in here with my light purple, and I'm just going to kind of come here and just really round it. Off the screen here. Okay. And just be very respectful and, again, intentional with our restoration and not damaging the cusps. And just trying to follow and respect that anatomy. And you can see how nice and defined our grooves are. And again, this is, I could touch this up a little bit more with some a burr just to get any last little flash. I'm just going to use my disc here real quick. And again, it just bends so nice and beautiful. And this is also a good part where if you have a little flash at approximately, like I mentioned, the scalpel is going to really come in handy. But then all I have to do is just polish it up a little bit. We have our grooves. We're going to be respectful to our inclines. We're not going to, excuse me, destroy our beautiful anatomy that we just built. So you can see we follow that anatomy very respectfully, and we're just kind of brushing just to get that little bit of flash out of there and polish everything up. Is it perfect? No, nothing I do is perfect. I'll be the first person to admit it, but I think if I needed a class 2 restoration, I'd be pretty darn happy to have this one in my mouth. And then I'll go with the lighter pink. And again, you can actually go a little softer with this one and push out a little harder. And then this one's going to give us a little bit more of a shine. Fortunately, my at-home drill just kind of has one speed, even when I adjust it. So I apologize I don't have my air syringe here, but that's our final product. And like I said, I know that my patient's going to be set up for success a lot better long-term, because I took the time to do it right the first time, to build with the end in mind, to give them back what they should have had in the first place, which will set them up for the best possible outcome long-term. So I've got 2 more minutes to finish up with everything. Let me just go back to my PowerPoint real quick. Here we go. I mean, there are a million different ways we can use matrix systems. This is an example of my recreation of doing a DO on a second molar, maxillary second molar, using my rubber dam clamp as my forceps. This, I didn't take photos of it in the mouth, but this is my recreation. Get creative, use flowable to hold that matrix in place so that way you get that more ideal contour. Use Teflon tape as your wedge. You know, don't be afraid to double band, double wing, or put the double ring on if you have an MO and a DO. don't be afraid to, get experimental, use Teflon tape to help hold things in place. Again, you have a big space, use flowable, use Teflon tape to pack in the space. Ultimately, the real takeaway that I hope you get from hanging out with me for the last hour is this, and this is something I try to remind myself every day. It's not about being the best. It's about being better than you were yesterday. So I just wanted to say thank you so much for taking the time on a Thursday night to listen and watch me play around with some of my favorite instruments and techniques for Class 2 restorations. I really appreciate Hands Online Live and Henry Schein for inviting me to speak with all of you. And if you have any questions, concerns, you want to clarify anything, you want any additional recommendations, or you just want to tag me in some of your Class 2s, or especially if you are posting with some rubber dam, please feel free to send me an email or tag me on Instagram. And then until next time, thank you so much for having me. Hope you have a great night.
Don't go away quite yet, because I know we have a couple of questions here. So I'm going to try to share my screen for a second. One of the reasons that we like working with TDSC is that they typically will offer some type of special with Shine. I'm going to share my screen. And I apologize, it's not full screen, but I can't see the questions if I don't have it in full screen. So, basically, there is a promo. If you go on to, let me see if I can get it up here. Not used to the format here a little bit, but if you use the CC Extra, if you go to tdsc.com, you use CC Extra, you'll get 10% off of all of the Clinician's Choice branded products on that website. So that is the special, and I'm going to go back to not sharing my screen, and let me pull up the Q&A here. Let me just see. As a reminder, and I mentioned this at the beginning, so I know some of you may not have hopped on initially. The webinar was recorded. That typically will be sent out in the next day or two. If you have paid for the continuing education credits, be on the lookout for a follow-up email from Hands Online Live with a link for a CE evaluation. That should come tomorrow. It's a really short survey. You just fill out the survey, and then the CE will be sent to you. So keep an eye on that. Like I said, that should come tomorrow. So what if people are having issues with moisture contamination? What is that typically due to, and what's the best way to resolve those?
Moisture contamination with rubber dam, it's usually because your rubber dam isn't inverted. One of my favorite tricks is to actually take a really sharp explorer. It sounds counterintuitive, and then have my assistant come with some air and actually, just use the tip of my explorer from the tooth down to the rubber dam and go around the sulcus while she comes around with air, and it helps invert everything. I don't do a lot without rubber dam. But if you're trying to do a Class 2 restoration without a rubber dam and you're getting leakage, it's because the apical aspect of your box is not sealed, which is a problem. So that's where, if you have your wedge and it looks like everything is sealed really well, I'll do one of two things. I'll sometimes take the wedge out and wrap it with Teflon tape just to give it that little bit of extra stability and push against the matrix to try and seal that little bit. Or I'll even take Teflon tape directly around the wedge and kind of pack it in there just to help kind of keep the moisture under control, because Teflon tape is literally meant to block moisture. So that's one of the beauties of using Teflon tape in that area. But usually if there's some kind of contamination like that, it's because you don't have a good seal. So you need to, again, take the time, take a step back, and then put, re-matrix, re-wedge. It takes time up front, but if there's moisture contamination or if your matrix is loose, you're not going to get a good restoration. So it's worth taking the extra couple seconds to readjust until you get it right.
Okay. Yeah. So for people that are doing Class 2 restorations, one of the things we hear a lot of is that obviously there's a lot of concern and stress about not touching that adjacent tooth. Do you ever recommend things like prep guards or other systems like that in order to prevent that from happening?
Yeah. So one of my favorite quotes from one of my mentors was, there are two types of dentists, those that don't abrade adjacent, or those that abrade adjacent teeth, and those that lie. The reality is that it happens to the best of us. Um, what I do like having some kind of guard in there. I know that there are some matrix or wedges that you can get that have the guards built in already. Those are great options. Or even if you have a lot of, let's say, Tofflemeyer bands or something in your office, I hope you're using sectional matrices to actually restore. But if you still have some Tofflemeyers, you can put that around the adjacent tooth if you can kind of shimmy it down through the contact, just to give a little added layer of protection. I think it never hurts to be more cautious.
Okay. What about the flip side? What if you are preparing two class two side to side adjacent to each other? Are there any special tips or things that you would change if you're in that scenario?
Absolutely. So one of my big things is, personally, if I'm doing back-to-back class twos, I'm doing two things. I'm putting the matrices on both at the same time, because if not, the one matrix might push over, and then you'll have one really, oval and into the other space, and one that's kind of like bent back. So you have a really small one and a really big one. I like to put both matrices in, restore the first one, pull that matrix, so that way you're not creating a gap between those two teeth. These matrices are super thin, but I like to build that contour against the natural tooth. But by having both matrices in there, it kind of keeps it from getting, crossing over that midline and making one super wide and one super narrow. And then, like I said, I just take out the matrix, I restore one fully, and then I'll restore the other one. So if I'm doing, let's say, a quadrant, sometimes I'll do, let's say, if I'm doing 12 and 13 MODs, then I'll do the mesials of 12 and 13 restore start to finish, and then I'll pull the band and do the distal of 12 and the distal of 13. So that way, again, I'm getting as tight a contact from the matrix to the adjacent tooth or the adjacent restoration. It's a really
Okay.
good question.
So you complete the restoration, you check the occlusion, everything is great. And the patient complains after a couple of days that they have a lot of pain from chewing. What would be typically the diagnosis for something like that?
Yeah. So for whenever patients complain with chewing, I'm automatically concerned about maybe, let's say, a working interference. So one of the best things I learned from John Coyce is that patients have no idea what right lateral, left lateral, protrusive movements are. So one of my favorite things that I keep in my office is this horseshoe paper that's 200 microns. And what I'll do is I'll have the patient I'll put it in their mouth right on their arch, and then I tell them to chew like it's a piece of lettuce. Although lately I've been trying to tell them chew like it's a piece of chocolate cake or something, and really kind of chew. Because if they're saying that they're having pain with the chewing, that means that there's something on how the teeth are coming together that's causing a problem. So I'll use that blue paper to see if I have any streaks anywhere that I need to adjust. And then once I have them do the blue paper, I take an 8 micron like AccuFilm red paper, and I'll have them just do straight tap, 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 little taps. So that way I can see where their MIP is hitting and where the disconnect is from their chewing. So I like to do it that way. So that way I can understand, where is the intervention, where is the problem, where is that interference? And then I adjust it from there.
Okay. Well, I think we are done with the questions. So I'll let you give us some parting comments and we'll call it a night.
Yeah. So thank you so much, everyone, for joining me. Those were great questions. So I really appreciate you guys bringing your A game, making me think real hard. I know you guys have lots of things you could be doing on a Thursday night. And I think by being here, you're already proving that you're doing above and beyond for your patients. And since they don't know that, I will thank you for doing that and spending the time with me. Thank you so much for having me. Have a great night.
Well, I want to thank you for your presentation and joining us. This was an excellent presentation. As a semi-retired periodontist, I still found it fascinating and loved every second of it. And hopefully they'll bring you back, because I think there's lots of stuff that you can talk about. But thanks to TDSC and Shine. As a reminder, if you go to tdsc.com and use that CC extra code. And I think they'll probably send out a follow-up email to everyone about that. But if you use that code, you can get 10% off of all of the Clinician's Choice products. Final reminder, we did record this. Keep an eye on that in your inbox. For those of you that did register for the CE, you will get a link sometime tomorrow that you can fill out a survey and get your CE forms as well. We do these on a regular basis. All of you who are here tonight will be on the invitation list for future webinars. So please stay safe and healthy out there. Thank you all for joining us. We know your time is valuable, and I hope you will continue to join us for these webinars. And we look forward to seeing all of you on the next webinar. Good night, everyone.